Good morning, everyone. I'm Lindsay Goldfarb, MHA's Healthcare Education Program Manager, and on behalf of the Massachusetts Health and Hospital Association, welcome to today's Executive Insight Series webinar. MHA is excited to host this unique series, which will feature candid interviews of hospital leaders and will continue throughout 2021. Today's theme is the strength of our community hospitals. A few logistics before we begin. We'll be recording this session for those who aren't able to join us, and all lines will be in listen-only mode. If you have questions during the webinar, please enter them into the chat box. The questions will come directly to us, and we'll do our best to address as many as we can during our time today. Following the webinar, we'll be sending out the webinar recording along with a brief survey. I'd like to take a moment to thank MHA's 2021 sponsors for their support in underwriting MHA's education program. In particular, I'd like to thank today's program sponsor, Verrill, a nationally permanent law firm. Verrill has been a longtime member and a supporter of MHA. Now I'll hand it over to James Roosevelt Jr., Counsel, Healthcare and Life Sciences, to say a few words.
Thank you very much for that introduction, Lindsay. Yeah, I appreciate it. And as a former board chair of MHA, it's great to see so many old friends and quite a number of new ones joining us today for this presentation. It's also great to be with my Verrill colleagues from our healthcare and life sciences practice, Kate Healy and Gary Rosenberg. As you are all very well aware, this past year has presented many challenges for healthcare institutions of all sizes and specialties. With one full year plus of the pandemic behind us at this point, healthcare leaders are still faced with the challenges of navigating new regulations, ensuring the safety of employees and personnel, and furthering the telehealth capabilities in today's environment. At Verrill, our healthcare and life sciences attorneys have been helping those in the healthcare industry navigate these challenges and evolving areas of law. We pride ourselves, however, not only on staying abreast of changes in healthcare law, but also on industry trends and best practices to best serve the ever-evolving needs of our healthcare clients. Today, we will hear from Christine Schuster, the distinguished president and CEO of Emerson Hospital, on her own experiences and the strengths of our community hospitals, the pillars of our communities. Without further ado, I'm pleased to introduce our moderator for the morning, Steve Walsh, our president and CEO of the Massachusetts Health and Hospital Association.
Thank you very much, Lindsay, and thank you, Jim. And thank you all for joining us this morning for our second Executive Insights session. And Jim, it's always good to be with you. You mentioned as a past chair of MHA, but most importantly for all you have done over the course of your career for patients in the Commonwealth of Massachusetts and always putting our patients first. You've been a true leader in our healthcare community. We appreciate you being with us for a few minutes this morning.
Thank you, Steve.
Those who joined us for our series premiere last month, welcome back. And those that are here for the first time, welcome. And we're grateful that you're spending a little bit of your morning with us today. The goal of this series is to share the unique perspective of our hospital CEOs and to give you a look inside what has made them the leader that they are today. As a healthcare system, we have never been more coordinated or more committed to working together than we are right now. But that's not a function of us all coming from the same place. Our healthcare community is great because of the wide array of backgrounds and viewpoints that our leaders bring to the table. With that in mind, it's my pleasure to introduce today's guest, who is someone I have gotten to know well over the last few years. Christine Schuster is President and CEO of Emerson Hospital in Concord and the treasurer of MHA's Board of Trustees. Chris has over 25 years of healthcare experience and has led Emerson since 2005. She has also served as president and CEO for Quincy Medical Center and Athol Memorial Hospital. So she has become one of the most knowledgeable and trusted voices for community hospitals in the Commonwealth. In addition to serving on the MHA board, Chris serves as chair of the Massachusetts Value Alliance, chair of the Massachusetts Council of Community Hospitals, and is a board member of the Massachusetts chapter of the ACHE. She is a regular on the Commonwealth Institute's list of women-led businesses and is a 4-time winner of the American Hospital Association's Grassroots Champion Award. She received her MBA with honors from the University of Chicago and a BS in nursing from Boston University. And I am privileged to have her here today and pleased to be able to call her my friend and colleague. Chris, thanks so much for joining us today.
Thanks so much for having me, Steve. And Jim, I was tickled when I learned that you were going to be the sponsor of today's session. I've admired your work for many, many years and really have looked up to you for the leadership that you've provided for all of us in healthcare. So thank you for sponsoring us today.
Thanks, Chris. And thanks again, Jim. Chris, last month we heard from Eric Dixon, and he talked a bit about his training as an Army medic and how that helped shape his view on healthcare and his approach as a leader. So you have a little bit of a different background. How has your training and experience as a nurse, someone who was by the bedside for so many years, informed your journey as a healthcare leader?
So, Steve, I love being a nurse. I use my nursing skills every single day of my job. And my 5 years working at now Boston Medical Center and then Beth Israel in the intensive care unit really helped me to understand what patients and their families go through when they enter the healthcare system. And our system is very, very difficult to navigate. And so it helped me to see the things that have worked really well in healthcare today and the things that actually don't work so well. So it was really great being able to help patients and their families one by one. But after a certain amount of time, I knew that I wanted to affect change on a larger scale. And so I researched the ways that I could do that. And I thought getting into administration, especially understanding general business principles, was going to be the best way that I could impact change on a larger scale in a way that I could someday run my own hospital where I could create a culture that made it easier for patients to navigate, made it easier for staff to work together. And, one thing I learned very young was I played a lot of sports, field hockey and basketball and softball, and all those sports required working together on a team. And if it's one thing that I've always taken away with me in healthcare is it really is a team sport. And we have to work together. We have to collaborate together for the good of the patient. So I knew if I got an MBA and that I was able to take my love for patients, my fondness for working on teams, and my business knowledge, that I could become a leader that was able to create a culture where everyone could work together for the good of the patient.
And obviously you've done that incredibly well. One of the things I've heard you talk about a lot before we dive a little bit into the specifics around community health is the path that you also took as becoming a CEO as a woman. What that was like. And I've heard you talk about mentoring young women in healthcare. You were also a leading advocate to move the MHA Board of Trustees to be 50% women, which we've now achieved. Can you talk a little bit about that experience and what you being a mentor to so many has meant to you?
Sure, Steve. Many women that reach out to me, and I love talking to them about this, is how do you be a mother, a daughter, a sister, a friend, and a CEO? That in and of itself seems like a huge responsibility. And what I like to say to them is, I think you can have it all. I just don't think you can do it all. And so what that means to me is being able to reach out and get help in different ways. Talk to your mentor about how to balance work and home. I think having a supportive spouse or partner and very supportive colleagues has really made a difference for me. Talking with other women about how do you do this? How do you do that? Especially when your children are little. I have a husband, 2 children, one who's headed off to medical school at Tufts next year, and one who's deciding on where she's going to go to college very soon. 3 cats and a very rambunctious Labrador retriever named Casey. So I have a lot to balance in my life. And I've learned that I can talk with other women about how to deal with the home life, how to deal with work life. But I would encourage every person who has that challenge, whether you're a woman or not, finding an organization that supports you having a family, a growing family. Many of my team members have been with me a very long time. And I think that's because I appreciate and really support them, whether they want to coach their son's basketball team or whether they want to take a trip in the summer and be a camp nurse. So I think it's important to find a fit, a culture, an organization that allows you to focus on the things that are really important to you. And I've been fortunate to have board chairs and board members and team members that have allowed me to do the same thing, coach my daughter's soccer team, never miss a squash match, and travel to Texas to visit my daughter who's at Rice University. So I think it's very, very important for you to find an organization that allows you to do the things you want to do, both professionally and personally.
Yeah, I've felt that from you too, Chris. Matter of fact, I mean, over the past 5 years working together, you're always asking me, how's the work-life balance? You were excited when I told you I was coaching Little League. You said, leave the office, make sure you don't miss a game. And so I'm sure your team has appreciated that incredibly well, and the women in healthcare that you've been able to mentor over the years. Now, our issue du jour, though, is community health. And you are truly one of the biggest community hospital advocates that I've ever met. Can you talk a little bit about why you're drawn to community hospitals and what makes them so special and unique?
So, I've worked in both the academic, tertiary, quaternary centers. I've worked in post-acute, and I've worked mainly in community hospitals. And truly, I believe there's a place for each of those hospitals in our delivery of patient care. When you really think about it, 85% of the care that you'll receive over your lifetime can be delivered competently, safely in a community setting. I, in particular, love the community because it's a chance to get really involved. Here at Emerson, we serve 27 different communities, and we have programs going in all of the communities. We can easily bring people together. We have very supportive corporators. We have regulars that come to the hospital all the time, and it allows us to know on a very personal level the people that we're seeing and that we're dealing with. And so, for me, community hospitals are often the first place that a patient enters when they get sick. And you don't really think about a hospital till you need it. And, we find most of the time we first meet someone when they're having a baby, but then in the area that we serve, people move here to raise their families. And our emergency room is jam-packed with kids, some who have mental health issues, some who got hit in the head with a baseball, and then their parents who may encounter some health issues, and kind of everything in between. It's also a place where people stay. So we also see a large elderly population who are aging in place. And so very often people are using Emerson as their community hospital throughout their lifetime. And, especially during COVID, we saw that people didn't really want to travel to the city for care. And so for me, being able to bring some of Boston's best programs through the Mass General Brigham system to Emerson, as well as providing a number of our own services, really allows me to implement what our vision is. And our vision is caring for the community. And we do that across the board. We don't cut programs that are major losers like mental health, because we know that our community needs that. So, for me as a nurse, it's taking all those skills that I've had and to be able to care for the whole person, the whole community.
In your answer about community health, which, it really is right on in my opinion, but you mentioned mental health. And so I just want to go off on a tangent just for a minute, only because I know you've done some incredible work around mental health services for young people and the void that we see. Can you talk a little bit about some of the advocacy that you've been doing around our mental health issues for young people?
So, Steve, there was never a time, as we've seen in the last 12 months, with backups with young children as young as 4, right straight through to early adulthood, when whether it's too much time out of the classroom, too much gaming time, where they've really struggled. And so I've tried to raise awareness by writing about it in some op-eds, by offering educational sessions virtually in our community. And, recently we brought on Mass General telehealth psychiatry services into the community virtually, because we just ran out of providers and really felt an obligation to care for these people. Our work with MHA and what we're all doing to try to raise awareness of this issue, to talk with the insurers about mental health parity in terms of reimbursement. Your mental health is just as important as your medical health and your surgical health. And so how we continue to do that, I do think it's going to take all of us standing up and really sort of pounding our fists to get everyone to take attention about how important this issue is. And I do think it's probably going to get worse before it gets better unless we are really heeding this call to action.
Yeah, thanks for all your work. And I know we had a few minutes this morning to chat with our colleagues from Verrill, and this was the issue that came up, right? What's going to be there for mental health services as we come out of this pandemic? And we have no idea. It could be years where we're assessing and treating mental health challenges for the past 13 months. You mentioned the word support. I want to talk about support a little bit from a couple of different lenses. And your response to COVID-19. And can you talk first about the support that you gave to your caregivers, your people, your workforce throughout COVID-19? Because I know that was something that a lot of our other CEOs were drawn to.
So I still remember that day in March when my COO turned to me and said, "I'm going to stand up incident command." And so the very next day, we stood up our COVID-19 Incident Command Center. And as we started to see this unfolding and really not knowing what we were facing, we looked around the table and I said to the team, if we can't take care of our staff, we won't be able to take care of our patients. And I told the board, unless we can get everything we need, ventilators, personal protective equipment, and keep our staff safe, then we're not going to be able to keep the hospital open. And so then we went into, let's do it mode. And the first thing we did was make sure that we had personal protective equipment for all of our staff. And then we listened to them. And, I think if that's one thing I've learned over the years is really to listen to staff. They're in the front lines. They know what's going on. And they told us, we're nervous about going home with our clothes from work and bringing something to our family. So the first thing we did for them was to get scrubs. And then our auxiliary, who's just wonderful, made them handmade masks according to CDC specifications so that they could have them when they were in the community and for their families. And so we really made sure that we took care of them. Once that was all set, it's really hard when you don't know what you're facing every day when you come into work. You're worried about your family, you're worried about your children, spouses may be losing jobs. What we did was we just set out to take care of them. And our community, and this is where community hospitals really make a difference, rose up, and in order to keep the restaurants busy, the community raised funds to pay the restaurants to make food for the hospital staff. So it was absolutely amazing because on any given day of the week, you could be eating from the best pizza from the local pizza shop or from 80 Thoreau, which is this 5-star restaurant in Concord, and kind of everything in between. In addition, we opened up a food pantry because people were afraid to go to the grocery stores. And so we had everything from bread to spaghetti to tomato sauce so that folks would be able to fill a bag up on their way home. My personal favorite is the Be Well Center. And that was, we set up a spa-like area for our staff with massage chairs and oils and special teas. Of course, everything was social distance and had all the proper cleaning, but we created a little haven for them to be able to retreat to take care of themselves, to sit, and have a cup of peppermint tea before they went home, and to help them refresh and recharge for the next day. So I think it's really important to take care of the staff, because once you take care of your staff, they can take care of the patients. And that's really what happened at Emerson.
Yeah, and we appreciated all the learning that other hospitals were able to do from you and other members and colleagues. And, the second area of support that I found to be notable was your support for other hospitals. Can you talk a bit about at the time when your COVID census dropped, how you supported other hospitals throughout the Commonwealth?
So, one of the things I love about Mass Hospital Association under its current leadership is how everyone has really come together. In all my years in healthcare, I've never seen the collaboration, the coordination, the cooperation. The walls just have come down. And, in a crisis, these are the people I want to work with. So in all our calls, if someone was really busy, I would reach out to them or they would reach out to me. Can you take 2 or 3 patients? Because in our market, we're very spread out and we have not a lot of diversity. So we didn't have a lot of issues here and we didn't have a lot of COVID. But what we had was a lot of empty beds. And so, we were able to work even up into New Hampshire and locally in Middlesex County with the CEOs to transfer patients. And that really alleviated other hospitals who were feeling overstressed. We also, through the Mass Value Alliance, made sure that everyone that we worked with had PPE. And that was so important. And we shared our PPE, we always made sure we had enough, but we had more than enough because we didn't have a lot of COVID patients. So we made sure we shared that with other hospitals as well. So no one went without. And I really think that is what I love about being in healthcare is you never know what challenges you're going to face. And this was a true life or death challenge. And, we're still in it. But the ability to come together and help each other out. I was exhausted many times at the end of the day, but I felt really, really good that I was making a difference both in my hospital and outside of it.
Yeah, you're right. We're still in it, right? But we have to start to look forward. We want this to be behind us. We've been frustrated with some of the lack of compliance because we're so close to the end. But collaboration only works when people are willing to do that. And as you have shown, you are a leader in that area and always there for your colleagues, there for your patients, there for your community. But looking forward now, what's next for community hospitals? I mean, when we come out of this, what are the biggest challenges? And then what are the opportunities for our community hospitals moving forward?
So I've spent a lot of time thinking about this one, Steve, in my day-to-day life. And I do think when the dust settles, I'm very hopeful that if we can get the insurers to continue reimbursement, that telemedicine is here to stay. I think it's allowed us to deal with things we've talked about that are critical, like mental health, in a way that I want to continue, because that access, instead of waiting for an appointment, you can, and having to drive in when you're not feeling well, you can actually just get onto your computer and have an appointment. So I really hope that continues. I think it helps with chronic disease management and has made a difference in people's lives. The other thing is, we're on a Zoom call today where we have incredible engagement. Of the last few leadership meetings, our team has been talking about what has been really good about virtual meetings. And one thing that we've identified is the higher engagement. More people come to the medical staff meetings, more people are coming to unit and department meetings, and more people are coming to our virtual community events. Our Steinberg Health and Wellness Center, all the classes are oversubscribed and they're all virtual. So I think that virtual meetings have a place moving forward in order to keep connected with our community and also within our own internal community. So really figuring out where the balance is, I think, is going to be an opportunity for us moving forward. I think working from home has been a great satisfier for staff. And so again, figuring out how we can keep that productivity high and keep people in work when they need to be, but also working at home. Just a couple more. I think health equity has emerged as a really important issue. And I think it will be a challenge for us moving forward locally and nationally to sort of figure out how we get people to access our system, not just for their healthcare needs, but also how we address some of the social needs.
Yeah, thanks, Chris. I think that, and we've been doing a lot of work here, and you've been a leader in that. And Dr. Churchwell, Dr. Betancourt, that's going to be probably the biggest challenge of our time, and one that we must undertake as a healthcare community. We need to and ought to be leading in that space to make sure that every patient is taken care of, regardless of where they live or what their socioeconomic status is. You've been great to take a few minutes and talk about your journey today. If there's any questions in the chat, please throw them in. Any questions for Chris? And while we're waiting for that, let me give you a chance for a little PSA. I know you mentioned we're not through yet. What's the message that you would give to people in your community around COVID as we're hopefully nearing the end of this?
So I think people need to continue to be vigilant. The way we will get through this is doing what we've already been doing. Get vaccinated if you can, social distance, hand wash, and be mindful of all the recommendations that the CDC has put forth. And I think those will be with us for a very, very long time. So if everyone does their part, we will get to the other side of this much quicker than we will if everyone sort of jumps the gun and doesn't wear their mask and isn't social distancing before we're really ready for that. We don't know what the variants are going to bring, so there's still some unknown factors out there that we have to consider moving forward.
And Chris, a question we just got in the chat, and you referenced earlier on in your remarks about some of the members of your community early on being nervous to go to Boston. Well, some are even nervous to go to the hospital, right? So what are you doing to reassure patients that it's safe to come back to the hospital, and those that have delayed care, you want to get them back in to make sure that you can care for them? We're still seeing that reluctance among some patients.
So one of the things we've done is we've used, email, virtual meetings regularly with our corporators who are our ambassadors in the community, and our website to let people know that coming to the hospital is safe, and let them know all the precautions that we have in place. And how they don't want to delay care. For example, in our mammography staff regularly calls patients who have missed a mammogram or delayed it to make sure they can make an appointment for them, and let them know all the procedures and protocols we follow to keep them safe. And then many patients will say, wow, I was really surprised at how conscientious you were about keeping me safe, about cleaning and so forth. So I really think it goes back to educating people and communicating with them about what is happening on the ground level of hospital.
Sounds like it's a lot of person to person in your community, and that's really what it takes in some instances. You brought up telehealth earlier. Is it here to stay? I mean, I think we all think it has to be here to stay. What do we need to make sure that this becomes a regular part of our healthcare system moving forward?
So I do believe, as I said earlier, it's got to be reimbursed by the insurers at the same level as a regular health visit. Once it starts to be reimbursed at a lower level, the dynamics of the business will mean doctors will probably ask patients to come in just to be able to cover the costs of their practices. So I think really pushing for insurers to treat a telehealth visit like a regular visit.
So, Chris, we're coming on the close of our time together. There's a question, but I'm going to make it more of a statement because I know you're doing it. Have you thought of highlighting patients who have come and had a good experience? And I know you're doing that. We're encouraging all of our hospitals to do that moving forward, because we want to hear from our patients. They're really our best advocates in many ways to talk to other people, make people feel safe and comfortable. So we've come to the end of our time today. Chris, thank you for joining us. You packed a lot into a half hour. You've done a lot. You're an important voice in community health, an important voice in this space. So thank you. We are so fortunate to have you as part of our board at MHA. The Concord community is a healthier place because of your leadership. So thank you again. Thank you to Verrill and all our sponsors, and to all of our attendees for being part of today's Executive Insight series. MHA offers virtual programming like this every week of the year. We encourage you to visit our website for more information and to join us for our next Executive Insight session on April 21st, when we'll be joined by Kate Walsh, President and CEO of Boston Medical Center. Don't forget to mark your calendars for one of our other upcoming conferences, MHA's Spring Forward Leadership Summit, Thursday, April 29th from 9 to 12. Thanks for spending your morning coffee hour with us. We truly appreciate your dedication to our healthcare system and to our patients. Have a great day. Chris, thank you, and I'll give the last word of the morning to you.
Thank you, everyone. Stay safe, be well, and go out there and advocate for all of our patients. That's the most important thing that you can do to keep Massachusetts strong and healthy.